Sophie Wenzel, and I'm at Virginia Tech, and I am Associate Director for our Center for Public Health Practice and Research, which works really closely with Extension. And then I'll pass it off to my colleague, Tiffany.
Hi, I'm Tiffany Freer. I'm the co-project director for Excite and a health extension specialist at Virginia State.
Hi, everyone. I'm Dominique Villani. I'm a project associate at the Virginia Tech Center for Public Health Practice and Research.
So yeah, we are here to tell you about our project, which focuses on adult vaccine educations that is funded by the Excite project. So let me see. So first, I feel like I need to explain for those of you that don't know, Virginia Cooperative Extension is actually two universities functioning under one Virginia Cooperative Extension system. So we've got Virginia Tech, which is in the southwest part of the state, which primarily serves a pretty rural population. And then Virginia State University, which is a historically Black college and university on the eastern side of the state, that serves the Petersburg area and beyond. So we have been working collaboratively on Excite for 2.5, 3 years now. So what is Excite? It's a national initiative. It's funded by the Extension Foundation, USDA, and the Centers for Disease Control. And the goal is really trying to address health disparities by reducing vaccine hesitancy, specifically in rural areas and medically underserved areas. So our goal is increasing adult vaccines and reducing hesitancy. If you want more information about the project specifically, our website is under there. So what does this look like? Right now we are in a third phase. So we had Excite 1, Excite 2, Excite 3. This is really our implementation phase where we're getting on the ground. We're really leveraging those partnerships that we created. This is 1.5 years long. It's the third of 3 phases, and it's really building on what we started, and we'll tell you more about that. There's 32 projects nationally that are currently getting funded through Excite 3. The difference that they added in Excite 3 is that we're no longer just doing community outreach, but we're also engaging with our cooperative extension agents. So we're focusing on the land-grant university too, and increasing vaccine confidence, not just for community members, but also we're basically training cooperative extension agents to serve as vaccine ambassadors and educators as well. And there's partnerships with public health, and we'll show you what those look like specifically in Virginia. So here's what Excite looks like across the country. I noticed there's a few Excite other funded members that I've recognized through calls, so it's great to have you here. You can see yourselves on the map. So yeah, it's all across the country, and you can see us there in Virginia. This is the 4th iteration because one activity had 2 phases. So we've been doing this for a little while. So Excite 3 specifically in Virginia, like I said, it's the 3rd phase. Our first phase was really focused just on COVID-19 vaccination. You know, it started off, we were still in the middle of the pandemic, and the focus was increasing the COVID-19 vaccine. The second phase of Excite really expanded it out to all adult vaccines. Specifically in Virginia, we're focusing on still on COVID, shingles, pneumococcal, Tdap, and influenza. Those are the vaccines that we chose to focus on. And in Virginia, we're partnering closely with local health departments, cooperative extension, and then we have a vaccine ambassador model that we are going to tell you about, which is really taking trusted messengers from their communities, training them as vaccine ambassadors, and having them provide education in their community. So our approach, we've kind of have these three buckets for our vaccine education approach. The first one is that promotion approach, which includes a social media campaign to, again, promote vaccination, reduce hesitancy, developing and distributing a bunch of different materials, posters, flyers, promotional materials, educational materials. We'll talk a little bit more in a bit about specifically what those look like. A vaccine education website. We do a lot of outreach, so tabling at different community events, fall festivals, back to school, different community events. We've engaged a wide range of community partners from health departments to other community partners, with the goal of really meeting people where they are. We have trained Virginia Cooperative Extension agents, both as vaccine ambassadors and really just to get them to feel comfortable, even if they don't want to be a vaccine ambassador, they can learn how to take some of our materials and incorporate them in their regular programming. And then we're hoping to start community engagement studios soon. For those of you that don't know, it's a way to get healthcare providers and community members together to talk about how community members want to hear about vaccines from their healthcare providers. So it's a facilitated discussion because we've heard from people that they want to hear from healthcare providers. So we really want to facilitate that discussion. How's the best way for this conversation to happen? We also have a variety of hands-on educational activities, engaging games that bring people to tables. We have fact sheets, facts and concern cards, different FAQs. We have an agent toolkit that I'll tell you a little bit about, where we just give agents materials that they can use to provide education. We had a symposium at which we taught agents how to communicate about vaccines. Excuse me. And then we also engage them on how to do motivational interviewing, what motivational interviewing is, and how to have conversations out in the community. Then we also have a prepackaged educational session, which agents can take, deliver in their community. There's a pre-post associated with it, learning outcomes, etc. So one of the things that's very important to us is just listening to the community and understanding how the community can help inform our educational efforts. So we've had a subject matter expert board since the beginning. That's people both on both of our campuses, but it's also people out in the community, including different agents that really help inform the course of our work. When we started off, we knew that Cooperative Extension wanted us to engage with local health departments, but instead of just going to them and saying, hey, here's what we want to do, we took the approach of asking them how they might want to partner with us. And we heard really different things from different health departments. For example, there was one that was really short on outreach staff. So we were able to hire outreach staff to work alongside their community health workers to help promote vaccine education. In another one, the local health department was just starting a partnership with United Way. They were doing a COVID event, and we were able to partner with them, which turned out to be a great relationship with Craig County, United Way, and the schools there. So we really partnered with the local health departments based on how they wanted to partner with us. We also conducted person on the street interviews. That's just what we call them. We wanted to hear from the real people, the people in the houses, on how best to reach them. So we conducted interviews in 6 counties, so on both sides of the state. And we asked about things like, attitudes about vaccines, barriers to vaccination, the type of messaging they wanted to hear. We got a big variety of responses. Some of the big things we heard was people wanted a slogan that emphasized the positive effect of the vaccine, getting vaccinated to avoid disease, and spending time with loved ones. I talked a little bit about Craig County. This is a project that we did in Craig County with the health department and with United Way. So United Way in Craig County was working on a remembrance event, and so we partnered with them. And what we did is we set up a booth at the Fall Festival in Craig County and set up what we called a story tree. And as people came up to us, we engaged them by asking them a question: how did COVID impact you, and how have you seen your community be resilient? And people could write down their answers on a little note card and put it on the tree. We were also, of course, available to talk to them. There was a lot of talking. Some people talked for 20 seconds, others talked for 10 minutes. We were there to talk to them and to engage with them. For those that were open, we engaged in vaccine education using principles of motivational interviewing to have those conversations. We had vaccine education, but we also were willing to just talk about what they wanted to talk about specifically around the topic. So we collected all those note cards, and just as an aside, some of the topics they talked about were there's a lot of talk of resilience and the community coming together, of hope, but also stories of loss. both people being lost, jobs, stories of hardship with schools closing. It was a really, really powerful event and discussion that we were able to have. And then in Craig County, we also partnered with the local cooperative extension agent who was very willing to work with us on some things, but not on other things. As you all are probably aware, in some rural areas, there's, politicization of vaccines. And this one agent really did not want to be the spokesperson for the vaccine. She felt that it may hinder relationships in her community, and we were very respectful of that. Instead, she put us in touch with the 4-H teen group in her county. And this was an amazing group of teens. So we ended up doing a photo voice project with them. So we asked the teens the same question: what did COVID look like in your community, and how have you seen your community be resilient? So even though this wasn't direct vaccine education, we were able to engage the teens on not just on the topic of COVID, but we also talked about vaccination in a way that felt respectful and approachable for everyone. And so the students, I think it was about 8 students engaged in this project. They went out and took pictures and then came back, and we talked to them, interviewed them. And then we were able to show their pictures at the United Way Remembrance event. And at the end of that event, the principal came up to me and she was like, "Oh, I really want these for the school board." So they're now hanging in the school board office in Craig County. And so this was just a way to engage the local youth, to have them tell their story, and to engage in vaccine education with them. It's just one of the pictures. This is a picture that Lexi took. All of us in Craig County are used to being out and being together, so I think it took a hard impact on everyone. For those of you not familiar with Photo Voice, basically you give a topic, people go out and take pictures, you come back and talk to them about their pictures, and you get a quote from something that they said that exemplifies it. And then one other one, and I realized I chose 2 from Lexi. There was other students, but so Lexi shares here, not only did I lose my grandfather, but due to COVID, other families lost loved ones too. And this is a picture that she chose to share. So these are some of the materials that we created based on the feedback we heard from the person on the street interviews. We created the Show Your Love, Get Vaccinated campaign. So these are some of our flyers and some of what we use in our social media materials. We heard that people really wanted to see real people rather than cartoons on their posts, families together. We have a lot of rural areas in the Southwest region. So we had one related to animals. And these were distributed widely and again used on social media, etc. So I will now hand it over to Tiffany, who's going to talk about some of the outreach that was conducted on the eastern part of the state.
Okay, thanks, Sophie. So on the eastern side, we initially focused primarily on urban areas, and this was for Excite One. So we partnered with our campus organization, the Public Health Institute at Virginia State University, the Petersburg Housing Authority, and a regional Walmart pharmacy to hold 6 vaccine clinics in medically underserved areas. And these included senior housing apartments, community college campus, and then attending community day events and health fairs. And then we also developed and adapted some interactive tools that we used for tabling activities. And you can see our program associate here doing what's called the Pathogen Buster activity. And the goals with these were really just to open a conversation about vaccines and the immune system and how they both work together to keep us healthy. And so in addition to these tabling activities, we also developed some additional materials for educational purposes, and then also as behavior prompts. And the QR codes on these link to the vaccine locator website that's put out by Health and Human Services. And then we also, in conjunction with that, did a social media campaign. This was our Vax Yourself campaign, and shown here is our carousel ad. And this ad ran for 30 days, and it did reach a little under 138,000 people. But we had 14 ads in total, and the goal with these was to increase awareness and prompt behavior change related to COVID-19 vaccines, and then reinforce those protective behaviors around reducing the spread. And these posts were really targeted towards the eastern side of the state, which is more populated. And then it was driven by data from the Virginia Department of Health based on their positive case rate data and vaccine uptake information. And we were able to really prioritize specific demographics by location, age, and then sex distribution. And then we also had a poster awareness campaign. These posters were developed in collaboration with extension agents and also our communications department here in VSU's Cooperative Extension Department. The locator on these again goes to the HHS Vaccine Locator website. And these were distributed to extension agents, our community partners, campus-based organizations, and then put up in locations around the community like bus stops, health centers, things like that.
I told you about our agent toolkit before. Here's a little bit more details about what went into that agent toolkit. This is something that can be given and is given to cooperative extension agents to help them in their vaccination efforts. So there's a adult vaccine schedule, handouts and magnets, facts and concern card for all adult vaccination, little quick facts about each vaccination to help the agents have that conversation, different educational handouts, different ideas of types of social media posts that they can use, a flip book, which really has more details about all the different vaccines that we're promoting. And finally, the educational session that I told you about where it's on a PowerPoint, there's speaker notes and everything that can easily be used. So this, all of the agents that attended the symposium and then are receiving the vaccine ambassador training get one of these agent toolkits. And then at the last Virginia Cooperative Extension Winter Conference, we partnered with the Virginia Department of Health Adult Immunization Program and the Office of Health Equity to teach agents about common immunizations and to really engage in a discussion around vaccine hesitancy. We discussed success stories from different agents that had been out in the field doing the work, talked about different strategies that agents can take, agent to agent, peer to peer. We had a facilitated discussion on barriers to vaccine education and how we could help overcome some of those in the community. We also had a display table of resources and activities so they could see what it was like to engage in these activities and to conduct the outreach. As different agents came up to us, we asked them, well, do you do vaccine education in your community? Would you like to? Those that said they would like to got on our list, got invited to the symposium, and are being trained as vaccine ambassadors.
Okay, and then we also held a statewide vaccine education symposium, and this was in partnership with the Virginia Department of Health. And this symposium was used to promote the Excite project and then also our vaccine education program throughout the Virginia Cooperative Extension System. So the symposium had sessions covering immunization basics and the adult vaccine schedule, vaccine hesitancy, and then a training on motivational interviewing, and then providing information to agents on how they can get involved with both the project and also buy into the vaccine education program. And so these are some of the opportunities that we currently have available for agents to get involved with this. Agent buy-in is something that cooperative extension agents do when they're doing their plan of work. They buy into programs that they're going to participate in. And that was available this year under the Healthy People, Healthy Communities program team. And this really helps to establish vaccine education as an ongoing program, regardless of grant funding, so it can be supported by multiple grants, in this case, Excite. And this program's open to all agents, content areas, and localities. There are flexible training options, tailored program options as well. So if agents are interested in just, adding materials to their current list of things they're providing, we can provide that for them, but we can also train them in some conversational talking points, or they can go through our vaccine ambassador training that Dominique's going to cover in just a minute. And then coming up this spring, we're hosting 2 regional summits, one on the eastern side of the state and one on the western side. And this is really to bring together cooperative extension, local health departments, and our community partners to do a learning exchange around this area and to really troubleshoot any needed information and really fill the gap in vaccine education so that we can do some community planning and really reach the right people with the right information in each location that we're working. And then our vaccine ambassador training, which is open to all agents and partners as well. And Dominique will talk about that in some more detail. And then as far as partnering with the Virginia Department of Health, we've been really fortunate to partner with 2 divisions at the state level of VDH. And these divisions have provided community level data on vaccine rates for priority populations and co-hosted our town hall and our symposium with us to support agent training. And then at the local level, we've partnered with 5 local health departments on community engagement over the course of the project.
New to Excite 3 is our Vaccine Ambassador program, and the Vaccine Ambassadors serve as community champions to promote adult immunizations. And they do this by identifying local events and organizations and developing partnerships to bring vaccine education to. So for example, they provide education during mobile clinics, health fairs, festivals, small group presentations, and tabling events. This includes incorporating vaccine education into existing cooperative extension outreach. They've built local partnerships, including connecting with local leaders and organizations through coalitions and connecting with local pharmacies and health departments. They are welcome to tailor our educational messages and refine our materials in order to make them culturally relevant to their county. And later, they will assist in recruiting community members to take part in community engagement programs. The vaccine education programs are research-based, and our education materials are developed from trusted sources that provide the most up-to-date vaccine information available. Before they were ready to go out on their own, they each completed a 10-hour training that covered 4 major topic areas: vaccines and the immune system, vaccine hesitancy, readiness, and confidence, overcoming barriers to vaccination, and an overview of our community outreach education materials and resources. The vaccines and immune system basics section provided information on how the immune system works, how vaccines work to activate the immune system, common vaccine questions they may come across, local vaccination rates that were provided by VDH, and adult vaccine recommendations. Next, we utilized the Excite Washington State University Toolkit to teach ambassadors motivational interviewing techniques and how to build and teach science media literacy skills to prepare them for issues of vaccine hesitancy, readiness, and confidence. The Overcoming Barriers to Vaccination section touched on barriers and strategies to vaccination, including how to identify vaccine providers in your community and how to create a welcoming clinic. In addition, they also learned how the social determinants of health and cultural humility can affect access to vaccines. In the final section, once they had a good overview of the current issues of vaccines and the current ways to improve access, we went over our available outreach materials and resources that were developed by the VSU VT teams, as well as the resources available through the Excite network. Of the 5 ambassadors who completed the pre-post evaluation survey, 100% reported an increase in confidence on where to find evidence-based information, how to recognize incorrect information, how to deliver a vaccine presentation, how to explain how the immune system works, and how to use motivational interviewing techniques. Of the 5, 80% of ambassadors reported an increase in confidence in discussing vaccines with vaccine hesitant individuals. The training was first piloted with 4 ambassadors, and from their experience, we learned that it was important to include a time to debrief and a space to practice the motivational interviewing techniques together. And this will be included in future trainings. We also formalized the training in order for it to be easily replicated and extended to new ambassadors and new agents on different timeframes. The training is now delivered via a learning management platform, Canvas, and we'll have a formal debrief and practice session following the Canvas course. Using this new Canvas course, we will soon train Medical Reserve Corps volunteers to be vaccine educators alongside local health departments with their community health workers and employees.
So we have some additional funding supporting this project coming soon. These are currently pending. So the Extension Foundation has provided the opportunity to continue this work through 2 additional funding mechanisms: the Bridge Access Program, which provides specific funding to promote the CDC's Bridge program for people who are uninsured or underinsured so that they can access COVID-19 vaccines free of cost. And then the New Partners project, which we are partnering with the Virginia Rural Health Association on, and we're working with them to provide vaccine education in rural areas across the state. So with Virginia Rural Health Association, we'll be training community health workers, peer recovery specialists, and doulas to work as trusted messengers in vaccine education. And they'll be incorporating this role into their current roles so that they can provide one-on-one education sessions and also community presentations. And these are some of our outcomes to date for the Excite 3 project. So 12 localities statewide have participated in the Excite Phase 3 project. We trained 6 vaccine ambassadors and 48 extension professionals in partnership with VDH. Our ambassadors reached over 3,000 people in the first 3 quarters of this project. And then we are the national award winner for the Immunization Champion category at the National Adult and Influenza Summit. And that was this past spring. We accepted that award for our work around health equity on both sides of the state.
Just a few challenges that we feel we need to mention. Like I said, several agents in some of our more conservative rural areas didn't want to talk about the COVID vaccine for fear of losing community trust. And the way we got around that was partnering with them on different things and also hiring non-extension personnel at some points just so they could do the work on behalf of our team. Healthcare providers are hard to reach, didn't respond very well to our attempts to engage. So partnering with local health departments has been a lot more successful for us. Staff shortages, of course, in critical areas. At the beginning of this project, when we were in the thick of the pandemic, lots of procurement and supply chain issues. Defining the role of the ambassadors, and I was so impressed listening to Dominique speak, because this vaccine education, the ambassador training, has really taken on roots of its own, and I'm really excited to have it and hopefully to share it with Excite into other teams, because I really think a lot of work has gone into it. So defining that and how we've come to where it is now, defining what an ambassador does and is, we've come a long way with that. And then finally, competing priorities of the entire team. I think, each of us has probably funded 5-ish% on this, but it's something we all really care about a lot and are pouring ourselves into, all the while knowing that we all have a lot of other projects that we're dealing with. And then just some of our partners, as you all know, none of this work can happen without a whole bunch of partners. These are some of the partners that we've engaged with that have really made this work possible on the ground. So we are grateful for all their help and support. And then here's our contact information. So 3 of us are here presenting. The other 3 are active members of the team, just not presenting today. Yeah, and we will happily take questions. I think we have a lot of time for questions. I'm going to keep this up for about 30 seconds if anyone needs to write down emails, and then I will stop sharing so we can see each other better.
I have a question, Sophie. I'll jump in here. We just had a meeting. I just got off a meeting with Rural Health Association, and we were talking about this challenge, which you just mentioned, about training community health workers, those who might be the receptionists, those who might be the nurses at the community health workers, and what a challenge that has been. And I know it's part of your new partnership project. Have you considered or thought about doing any needs assessment with them about what their skill set is, what their interest is, what their barriers among them, to see how we could better reach that group? And I'm really asking for the whole project because that's the discussion we just had about whether we can learn some things. And Tennessee is probably going to come on as a new partners project, and they're talking about a similar kind of thing. And we think we're having challenges all around, but we're not aware of if there's been any needs assessment with this group about what skill set they have, what their willingness is, what their readiness is, and wondered if you have considered or have done any of that, given the challenges that you've had.
Yeah, no, we have not. And, specifically for new partners, we're hoping to expand our vaccine ambassador model. So to train community health workers, peer recovery specialists, doulas, but not specifically like that front office staff. But you're right, that's so important because that's the first person someone sees. So no, we haven't considered doing a needs assessment. I think we would certainly be open to it, especially for work that's happening in a healthcare setting where we want that initial conversation and initial interaction to be engaging and informative and pleasant. Yeah, I guess my answer to you is we have not thought about it, and we would be happy to partner on something like that.
Yeah. Well, I'm just wondering, and I'll end my question, but obviously I just got off a call where we were just having this discussion, wondering about if we pulled together all of you who are particularly trying to do some of this community health workers, what's worked, what hasn't. I'm hearing over and over again, it's been a tough group to get involved in our trainings. I know Delaware is doing this. Maryland has a project in that. We have a number of our states that have an interest in this, but I don't, my sense is that we're all struggling to get this. And why is that? What can we learn from that? And what can we learn from each other? So anyway, just two thoughts, whether we should be doing some needs assessment. Maybe we can do that across projects instead of just having that focused on one, and what have we learned from others, and maybe the first thing is to find out who all's trying to do this and what are we learning. So anyway, I just offer that
no, that's great.
For the conversation and thought.
And then partnering with the actual Community Health Worker Association. I know in Virginia we've got the Parent Association, and seeing how we could partner with them to help disseminate that to their community health workers.
Yeah. Thanks. I appreciate all that you are doing. It's pretty exciting stuff, and certainly award winning stuff. So appreciate being able to hear more. We often don't get to hear all the details, so I appreciate being able to join you.
No, thanks for joining. Anyone have any questions about anything in specific, or any part of the project we talked about? I know we threw a lot at you. There's a lot going on. I think all of our materials that we've developed so far have been shared with the Excite team. I think those are all now, I don't know if they're public domain for the Excite teams or for anyone else. I certainly, I want whatever we've created to be used by others. So by any means, please contact Excite to get a hold of things. Our ambassador training is, I'd say, probably 99.5% complete. We're about to launch it, the Canvas version. And again, we would love to have other Excite teams use that because we put a lot of work into it. And so we would love for others to use it too. Or non-Excite teams, anyone else who's interested in incorporating vaccine education into their work.
I had a quick question. I'm new here. This is my first meeting, but I did, we heard at the beginning that there's, several, vaccinations that you guys have chose to support. And that's when we were talking about the West Coast, and we went to the East Coast and it was mainly about COVID. So is there a lot of material set up for other things other than COVID? That is being around? And then also, is there an elevator speech or something that is given when you have derogatory remarks as to why they don't want to take a vaccination? Because we've gone through different eras of people saying mercury or this or that. And so I was just wondering how that was being addressed so that we could promote education and get those negative thoughts out of our minds,
Yeah, no, great question. So first off, the vaccines that I mentioned at the beginning, that's the priorities on both sides of the state. The materials that Tiffany was showing you were materials that they developed in the first phase, which was really focused on COVID, which is why you saw that focus. But now we're working together across looking at all those different vaccinations. And then your second question, so, there's a few ways that we do that. The big one is using the principles of motivational interviewing. So we all got trained as part of being funded by Excite, and then we're now training our ambassadors to be able to have those respectful conversations and to, really to start where people are, to engage them, ask them questions without being pushy. And then they all have their facts and concerns cards. They have different things that they can share. And we specifically call them facts and concerns instead of facts and myths. So we weren't saying, oh, that's just a myth. If someone has a concern, then we want to acknowledge that it's a genuine concern. So there's several ways that the ambassadors are trained to be able to deal with that. Of course, we also tell them that, we don't want them getting into an argument or getting confrontational. If they feel that they absolutely can't have that conversation with someone, then don't have it. We want them to be safe, of course. That's the first and foremost. And Tiffany just posted the Excite Project Asset Library if anyone is interested. And I also wanted to point out that Melanie has posted a short survey to give feedback for the session. If you all could click on that and just take 2 minutes to fill out the survey, they would appreciate that.
Can I just say, if anyone has any questions or wants some additional resources, if you can't find them in the asset library, please feel free to reach out. We're happy to share and help you in your project as best we can.
Well, if there's no other questions, I can head towards a wrap up. So, like Sophie said, there is a quick survey in the chat. And if you would mind giving us some quick feedback on this session and also what you want to learn in the future, we would so appreciate that. I will be sending out a recording of this session along with all the resources shared and the slides to everyone who registered, and this session will also be posted online, so you can get in contact with the Excite Virginia team if you want to learn more or anything. But thank you all so much for joining us. Thank you for teaching us so much and about all the great work that you're doing in the state. It's amazing what you've been able to do through the pandemic and everything that's been ongoing. So I was so impressed.
Well, thank you for having us, and to the Excite Foundation for the support.
Awesome. Well, I hope everyone has a great rest of your Monday, and we look forward to seeing you next time.
Thanks for joining, everyone.